I learn something every day, which is keeps the mind going. I don't think I could be at a job that just you are doing the same thing over and over again and there's no mental stimulation. Biggest reward, I get a sense of accomplishment daily. It's all pretty rewarding, and seeing owners happy, that's good too. And I think people are just as happy to have you remember their pet's name than they are their name. This is what I do as a veterinary technician. I'm a registered veterinary technician in the state of California at Paso Pet Care Veterinary Hospital. I have my bachelor's in animal science from Cal Poly. So I've been a technician for 15 years, a licensed technician for 15 years. You actually now have to do a veterinary technician program. There are online programs as well as in person. They do have online programs that last about 18 months. You do still need to have clinical experience of 12 months, still do the task list. It's a different test now. It's called the VITNI, and it is a national test versus just a state of California test. Some states also require that you do a board test for their individual state as well. So most hospitals will have one doctor or several doctors. You're usually assigned to one of those doctors, and then that doctor is either doing surgery that day or doing exams that day, or if you're at an emergency center or an urgent care, you would be assigned to those people who just do walk-ins. If we're doing appointments, it's usually pretty smooth and scheduled, and we can look up the history on each pet, go in, check in each appointment, prepare anything that might be needed, such as pulling up vaccinations, drawing blood if blood needs to be drawn. If we're checking an eye, getting out all of the instruments for that. We go and hold for the examination itself, and then take a brief history, and then do all the charges for that patient and then send them on their way. Appointments are usually a half hour long, so every half hour, an hour break and midday for lunch. And then we see 4 or 5 appointments in the afternoon. If we are a surgery technician, then all the surgeries check in the morning in a half hour time, and then we prepare paperwork. We present all the pets to the doctor. They give us the appropriate drugs to draw up, and then we do everything from pre-medicating, induce anesthesia, and get them prepared for surgery. We monitor anesthesia while they're in surgery, wake them up and extubate them when they're done, and then monitor them for things like temperature and pain relief throughout the morning. We also do x-rays when those are needed. We draw blood, we bandage, as licensed technicians, we are able to pull teeth when there's a dental. If your animal is just due for vaccines and the annual exam is not overdue, the assistants or technicians will take on that appointment as long as there are no doctor concerns. We do toenail trims, express anal glands, do blood draws, things like that. Basic algebra, honestly, is as far as I think that would be necessary in order to do the job, but there's a lot of dosage calculations and making sure that when you're counting tablets, you have enough for the instructions on the medication and how long you want it to last. So things like that. I also think that strength is one of the skills that you need to have. These animals are not excited to be here most of the time, and they range from 3 pounds to 153 pounds. And so you're never expected to do the 153 pounds by yourself, but if they want to go somewhere and you're, not exactly expecting them to do that, then you can certainly be challenged by their size and wiggling. There's a lot of wiggling. Well, every pet comes with a person, so people skills, I would say, are a good 50%. You can't, the animals can't tell you what's wrong with them. There are signs that can point you in a direction, but the observation really has to be done by the owner. And hopefully the owner is the one who brings the pet in, because sometimes you get, oh, well, I'm at work, so I'm going to send in my brother. Well, my brother doesn't live with the pet. So people have to feel comfortable with the services you're providing as well. You're not getting a shiny new object or piece of jewelry that you get to wear over and over again. It's like going to the mechanic. You spend, and you get a car that's fixed. Well, same thing with your pets. You're not getting a shiny new object, but you are getting your companion fixed. A lot of times you're in life or death situations, and you have to keep your head clear and remember all of those emergency protocols that you have been taught years ago that you haven't had to use in a very long time. It can be challenging because your back is sore from lifting all of the animals and having them helicopter in your arms. There's definitely a little bit of compassion fatigue that can go along with it too. You have that case, like I said before, that you've been following, and you just can't do anything else. That's kind of tough. I would say for me, compartmentalizing emotion versus the task at hand is I'm really interested in the medicine as well as the love of the pet. So I assume euthanasia is one of the biggest topics that you would have to separate yourself from. And most of the time I see it as a gift. It's not something that human medicine we're getting there, I think, but it's not something that's real common practice. And sometimes you're just seeing those pets suffer, and it's the person hanging on more than it is the pet wanting to be there. And the pets will hang on for you as long as you want them to, unless their body just gives out. And so I feel like it's a gift, which makes it easier emotionally. But there are some that get you, for sure. Those ones that a long time, or you've been going through the journey with them and doing everything you can. The owner's doing everything they can. Those, sometimes you do get a little choked up.
Sure.
The biggest reward I get, a sense of accomplishment daily, a sense of accomplishment. I learn something every day, which is keeps the mind going. I don't think I could be at a job that just you are doing the same thing over and over again, and there's no mental stimulation. And it's the little things. It's getting the blood draw on that dog that nobody else could get, putting the catheter in that small little animal, doing anesthesia on a species you've never done before. So sometimes I will see people in the grocery store because we're a small town, and I'll remember their pet's name, but I won't remember their name. And so I say, hey, how's, such and such. And I think people are just as happy to have you remember their pet's name than they are their name. Surprising. I would say that just because you're a licensed veterinary technician doesn't mean that you don't, clean up after animals. It doesn't mean that you don't get down and dirty. We are expected to do a lot of the technical skills, but we're up to our elbows in poop and vomit and nasty smelling things just as much as the kennel assistant might be. Right. So there's an administrative side, and then there's a technical side. So administrative side, you have usually a practice manager and an office manager. That person oversees CSR, which is the customer service representatives, as well as the technical staff. Then you have your customer service representatives, who are receptionists, veterinarian, registered veterinary technicians, vet assistants, and then kennel workers if you had a kennel worker at your hospital. So if you're a young person that wants to get into the veterinary field, I would say first realize that it's not every day is easy, and it's not just playing with puppies and kittens, although that is a fantastic part of it. But you need to graduate high school. You need to get into one of the programs, which there's a lot of math, there's a lot of science, a lot of biology. You need to know the anatomy. There's 13 species that you're tested on for the veterinary board. So I'd say study really hard. My suggestion would be to volunteer or get into a veterinary hospital or a shelter that would allow you to see if you like it. It's not for everybody. Just like human medicine would not be for me, animal medicine I can handle. But there are some people who are scared of the snakes and the reptiles or the birds and don't realize that that might be a part of a small animal clinic. Other people might think they want to be in the equine world and don't realize that 90% of your time is outdoors. So I would just say, get to know what a technician does and spend some time there if you can find a place that will allow. Some days are super easy and you don't see hardly any cases, or they're all, annual exams, and other days every case is a workup. It's all pretty rewarding, and seeing owners happy. That's good too.